Okay, welcome back to Crush Medical. We've got what I would describe an easy question, but students mess this question up all the time, so therefore it's a medium difficulty question. OBGYN, reproductive. Make sure to like and subscribe if you find this video helpful, and let's jump right into the question. We've got a 32-year-old woman who presents for infertility evaluation after 12 months of regular, unprotected intercourse without conception. She has regular menses and no history of pelvic inflammatory disease, endometriosis, or ectopic pregnancy. During this visit, you learn she is facing unrelated legal charges. What is the most appropriate next step? So, right off the bat, we can see that this patient is here for some fertility concerns. She has no past medical history of anything concerning, but she does mention there are some outstanding legal charges that she thinks is relevant in this context here, right? So let's just go through the options and we'll start from option E. So advising another 6 months of attempts before referral. So this is a nice distractor, and the point here is this is just incorrect here, right? So she's been trying for 12 months, her and her partner in this context. So if we were to just brush that off and just be like, hey, continue trying that again for another 6 months before we send you out to any referral services, that's just not effective, right? It doesn't seem like we're prioritizing what's in the patient's best interest, and therefore in this context it would be incorrect. Okay, the bullet here is that they do say that if a patient is over 35 and above, then technically you can suggest these kind of short-term measures, because it's a little bit, when it comes down to age, these things do matter. But in this context, she's a 32-year-old woman, we can say that that is incorrect. Okay, moving on to option D, which says refer her to psychological screening. This is a really just a distractor, right? So we can say that this is definitely not a correct answer here. There's no psychiatric barrier to conception, and therefore we are delaying fertility for this patient. Why? Because we want a psych eval? Like, it's just not something that makes sense, and therefore it would be considered inappropriate for this patient. Incorrect. Okay. Moving on to option C, refer her to a fertility clinic. Now, this is a really interesting option because you're essentially putting aside her legal matters and ultimately addressing what this patient is here for. And in this case, it is the idea that she needs some support for fertility purposes, right? So in this case, let's go with it. And that is in fact the correct answer. So she meets the definition of infertility. So somebody who's essentially been trying for 12 months, unprotected, and generally under 35, sending out to a fertility clinic referral is the appropriate next step, right? So we kind of quickly mentioned that she doesn't have any particular red flags, like no medical history of suggesting anything that could be affecting the reason for conception. So because she's generally healthy and she's been trying, it makes sense to give out this referral. And again, the biggest bullet point that students for some reason overlook here is that the legal issues are unrelated to her visit today, right? It doesn't change the medical indication for care. We still want to do what's in this patient's best interests, okay? So don't fall for this legal trap that the examiners sometimes throw at you guys. Do what's best for the patient, okay? So now that we've established that C is in fact the correct answer, let's just quickly go over B and A. Perform a semen analysis for her partner. So this is actually beneficial. Like this is something that could also be done as well too. And they say that male factor testing is also part of the workup, but ultimately she does need to be sent out to a fertility clinic, right? So that is where a lot of these of the secondary investigations, like semen analysis for her partner, would also take place. So essentially, it's still part of the referral. Okay, so therefore, it would be considered incorrect here. And then option A, defer evaluation until legal matters are resolved. This is just a distractor. The examiners want you to choose something like this. They want you to choose the idea that this patient has to address her legal stuff before getting any medical care, which is just incorrect for the boards. Okay, an unrelated legal issue is not a medical reason to postpone an indicated infertility workup, and care should not be withheld. Okay. So once again, if you found this question helpful, make sure to like and subscribe, and we'll see you in the next video.